I want to make sure that if you're injured, that not only do you feel better, and besides maybe trying to mask your pain with injections or drugs, and there's a time and place for that stuff, so I'm not knocking that, but I'm saying let's make sure that you're getting to the actual underlying cause of the problem and getting that handled as best as possible so you don't have long-term problems from the accident. Hi, Dr. Michael Pasternack, chiropractor with Winchester Spine and Injury. I'm going to talk today about what to do after a car accident when it's not your fault. The first thing you want to do is make sure that it doesn't seem like anyone is seriously injured in your car, and if possible in the other person's car. You want to call 911 next, and then while you're waiting for the police or the sheriff, whatever, to get there, if it's safe, go out and take some pictures of your vehicle, of the other vehicle, the right of way, maybe the intersection where it happened, things that would show, who had the right of way and what the problem was. If the other driver is admitting to fault, try and get that on video. That would be really powerful to have, with them admitting it so there's no problem down the road. If anyone is seriously hurt, then of course have them go by ambulance when it gets there to the nearest emergency department. But even if you're not seriously hurt, everyone should go to the emergency department and be checked out. That's what they're there for, and sometimes there can be a life-threatening injury that may not even be painful right then, something like a subdural hematoma or something. So, the emergency department is there to save your life. Go and get checked out just to be safe. After that, the next day, of course, contact your insurance agent. As you're getting treatment, you want to make sure that you speak with an attorney, hire an attorney to represent you, someone that works on personal injury stuff on a daily basis, because you need to have an attorney to represent you, because let me tell you, the other side, they have plenty of attorneys on their side. So, besides getting great medical care by someone that has specialty training, you want to, have an attorney that deals with this as well. And then I think here's the key thing after all that's said and done. You need to make sure you get proper treatment. Now, there's a lot of great providers in every community, but that doesn't mean that they have any specialized training or knowledge of auto injuries and what to do. In fact, I've been in practice 31 years. My first 27 years, I was a good chiropractor, but I didn't have any of this specialized training. And so it's important, if you have someone in your area that has specialized training, that's the person that you want to go to. In fact, I'm going to do a whole video talking about that, whiplash and chronic pain. So look for that, because I'm going to talk more about it. But it's really important that you see the right provider that has credentials and training in spinal injuries. Sort of like you can see, hopefully in the videos you look behind me, I have some credentials. I'm trauma qualified. That's really important. But you can see there's other things that I have training in. I've talked about this in another video, but I have training which is really important in MRI, spinal trauma pathology, mild traumatic brain injury and brain injury, impairment reading, accident reconstruction, orthopedic testing, spinal biomechanical engineering. These are really important subjects that help me to understand injuries, how to diagnose injuries, how to treat injuries, and how to get the absolute best result. And that's really what I'm sort of hinting at here is I want to make sure that if you're injured, that not only do you feel better, and besides maybe trying to mask your pain with injections or drugs, and there's a time and place for that stuff, so I'm not knocking that, but I'm saying let's make sure that you're getting to the actual underlying cause of the problem and getting that handled as best as possible so you don't have long-term problems from the accident. So if possible, see someone that has specialized training. If you're here in Winchester, I'm happy to take a look at you or help in any way. Because besides treating patients, I also work as like a quarterback, meaning I help manage these type of conditions. So follow us on social media. Have a great day. Dr. Michael Pasternack, Winchester Spine and Injury.